Good morning, everyone. Thank you very much for joining us. My name is Chris Arias from MemorialCare Health System here in Fountain Valley. We know there's a lot of information out there about the Medicare program, a lot of questions about it, a lot of misinformation about it. So we're here to hopefully provide some information that you find useful. So to that end, I'm happy to introduce Mr. Jose Juarez, our Medicare education specialist. He's going to take us through some content, and I'll be back at the end for some Q&A. So without further ado, Jose.
Oh, thank you, Chris.
Yeah, you're welcome, man.
Thanks so much. And thank everyone for joining today. Like Chris said, right, there's a lot of misinformation, a lot of information about Medicare, how to avoid penalties, where I'll be covering some of these information during my presentation. And any questions, please submit them, and Chris and I will go through them after our presentation. With that said, here's my contact information. So if you have any questions, you have any concerns, not sure where to go for resources, here's my cell phone number, my email address. You can call me or text me or send me an email or attend one of our free seminars. So with that said, so what is Medicare? Medicare is a federal health insurance program administered by the CMS. And this is a popular Medicare card, right? It has your Part A and your Part B. Part A is your hospitals and Part B is your doctors. As far as the effective date, I know a lot of people ask me like, well, my effective dates are different on my Part A and Part B. That's because when you turn 65, your Part A becomes active. Part A has no monthly premium. And then Part B, the moment you retire and apply for Medicare, it's going to have a different effective date. So who's eligible for Medicare? You do have to be a United States citizen or legal resident here in the United States. You have to be 65 years or older. Work in the United States for 10 years, which is equivalent to 40 credits. If for some reason you're under 65 and you are disabled for 2 consecutive years, you can apply for Medicare as well. Those that have ESRD or ALS. So what is Medicare? Medicare is your again, Part A is your hospitals, helps you cover inpatient hospital stays, skilled nursing facilities, hospice, and home health. Medicare Part B, this is your doctors, outpatient, inpatient, medical supplies, and preventative services. And Part C, these are very popular Medicare Advantage plans where you see commercials, phone calls, I'm sure flyers, right? During open enrollment, you get a lot of information on these Medicare Advantage plans. And then you have Part D, your drug plans. So Part A, again, it's your hospitals, helps you cover the inpatient, hospice, skilled nursing, home health care. Your deductible is $1,676 per benefit, and this is only if you're on original Medicare. Now, Part B, this one has a monthly premium of $185 for 2025. And your Part B premium, it's going to reflect based on your income. Okay, so not everybody's going to be paying $185. Your Part B is your doctors, inpatient, outpatient, preventative services, ambulance, labs, radiology, and any diagnostics. Original Medicare only covers 80%, and you're going to be liable for 20%. Okay, so that's 20% of bill of charges. So how do you cover that 20% and you don't have to pay for that? Again, so IRMA, this is your income. And in this chart, it will show you what your Part B premium will be based if you file taxes jointly or single. And it will give you an idea of what the premium will be, again, based on your income. Social Security and Medicare, they do go back 2 years to look at your income. So if you're thinking of retiring in 2025, they will look at your 2023 income where your Part B premium will be based out of. If for some reason you're retired and obviously your income is going to change, there's a form where I can email you, or you can go to medicare.gov and download this form, and it's an income adjustment form, right? And you take this to Social Security and you let them know, like, hey, I no longer make this much. So that way they adjust your income and your Part B premium. And if you have any questions regarding this, please feel free to reach out to me. So your Medicare Advantage plans, your Part Cs. So this have become very popular throughout the years. Medicare Advantage plans have no monthly premium, 0 copays for primary, 0 copays for specialists, and they have additional benefits, right? Like vision, dental, hearing aids, transportation, worldwide coverage. I get asked a lot, right? Like, well, it's an HMO. What if I travel within the United States? Am I going to be covered? You are going to be covered for urgent care and emergencies only. If you travel outside of the US, Emergencies only, you do have to come back with an itemized receipt and you submit them for reimbursement. Versus here, if you travel in the US, you just present your insurance card, but it's only for urgent care and emergencies only. Original Medicare does not cover any vision, dental, hearing aids, acupuncture, long-term care, or any transportation. Original Medicare is just your bare bones, your doctors, hospitals, and your drug plan. So Part D, this has been probably one of the biggest topics in 2025, biggest changes within Medicare. And the reason why is because the donut hole, right? The coverage gap, that went away in 2025. The maximum out of pocket is only now $2,000. It is going to help some, it's going to hurt others, right? Because a lot of the insurance companies, they dropped thousands of medications out of the formulary and some of their tiers shifted, right? Here with MemorialCare and GMP, we do contract with some of the largest Medicare Advantage plans where we can do a plan comparison and see what plan has those medications on the formulary. And maybe just your costs will go down, okay? Another big change, some of the insurance companies now have deductibles for Part D, okay? So if you're seeing your costs is going up on your medications, please call me, attend one of our free seminars where we can do a plan comparison and be sure that you're either going to be paying less or we find a plan that has those medications on their formulary. So your options with Medicare, you can go on the freedom path. So if you're used to a PPO plan, you want the flexibility to see any doctor you want, you can self-refer yourself to a specialist. I would highly recommend a Medicare supplement plan. And this plan does give you the flexibility, especially if you have three different specialists with different medical groups, and they're all very important to you. A Medicare supplement plan is going to give you the flexibility and freedom to keep all your specialists, right? You are going to be paying a little more. It's your Part B premium, your supplemental premium, and you have to go out and get a standalone drug plan. Supplemental premiums do go up every year. They're not locked in. Versus you want more of a savings path, a Medicare Advantage plan. 0 monthly premium, as long as you continue paying your Part B. Your drug plan is included and no extra cost. And we can shop around. We can do a plan comparison and see what plan has the best formulary for your medications. And again, you get those additional benefits, right? The vision, dental, transportation, acupuncture, chiro, worldwide coverage, over-the-counter benefit-free, gym memberships. You get all these additional benefits at a 0 monthly premium. Medicare Advantage plans also have PPO options, right? The PPO plans do have a monthly premium. Their maximum out-of-pockets do vary, and the benefits, okay? So if you want to see the differences between all three, please attend one of our free seminars. So again, the Freedom Path, it's a no network. You're not tied into one doctor. You can see pretty much any primary care doctor and specialist as long as they accept Medicare. Monthly premiums for Medicare do go up every year. Again, they're not locked in, and you have to go out and get a standalone drug plan. Your Medicare Advantage plans, I think they're amazing. It is an HMO, right? So if you want to see a specialist, you have to go see your primary care doctor first to get a referral. With MemorialCare, we do have My Charts, a patient portal where you can reschedule appointments, order prescription refills, and have constant communication with your provider. So if you want to get a referral, maybe have a virtual visit with your doctor and get a referral, you can do so. Enrollment periods. So your initial election period, this is when you first turn 65. Okay, you have 3 months before your birthday, the month of your birthday, or 3 months after your birthday. If you're still working and have insurance through your employer, you do not have to apply for Medicare. Okay, or maybe you're 65 and you have insurance through your spouse. Okay, you don't have to apply for Medicare. And then your annual election period. This is from October 15th through December 7th. And during this time frame, it's very important you don't miss the deadline, because during this time frame, you can shop around, do a plan comparison, attend one of our free seminars. We can meet either in a group or individually in the convenience of your home or one of our offices. And we can sit with you and answer any questions you may have and go over those plans that, we can do the supplemental plans, Medicare Advantage plans, PPO plans. Our goal is just for you to be educated of the options you have. Another very important time frame is open enrollment, and this is from October 1st through March 31st. So during this time, you have one more chance to change your health plan. And this is if you're not happy, you set an increase on your medications, Whatever the case may be, you can change one more time during this time frame. If you're currently on a Medicare Advantage plan, on an HMO, and you're not happy with your doctor's office, with your hospital, maybe your doctor is going to be retiring or already retired, you can change medical groups year-round. Here at MemorialCare and GMP, we have facilities from San Clemente to Long Beach, top quality hospitals and specialists, where I'll be more than happy to suggest or recommend any of our primary care physicians. Another thing too, so if you're still working, you're 65, you're Medicare eligible, and you're not sure if maybe going on Medicare is a good option for you or staying on your current employer plan. So your current employer plan, you have monthly premiums, obviously your dependents, you have higher deductibles and copays, right? On the Medicare Advantage plans, you only have your Part B premium, okay? You have no copays for primary, no copays for specialist, and you get these additional benefits like gym, transportation, worldwide coverage. So we can sit down with you and do a plan comparison and see if maybe your current employer plan is a good fit for you and your needs, or maybe a Medicare Advantage plan. Again, you can attend one of our free seminars. Now, how do I apply for Medicare? You can either go to medicare.gov, the Social Security website. You can give a call to the Social Security office or visit one of the local offices in your area. Again, this is my contact information. My cell phone number is on here, 714-640-7158. If you want to attend in any of our locations, one of our free seminars, please call me, email me. I know we're going to be sending out reminders of those classes that are going to be happening in the area. But any questions, you need a form, you need your Part B application, income adjustment form, any recommendations within our providers, please don't hesitate and call us, text me if you have any questions. By all means, you can always call me or text me or attend one of our free seminars. And Chris, I think we have some questions that came in.
Yeah, that's right. Thanks, Jose, for that overview. We do have some questions that came in, which want to make sure we have everyone covered here.
Absolutely.
So the first one we got is, does Medicare Advantage plans cover prescription drugs, or do I need a separate Part D plan?
Yeah, that's a great question. So no, Medicare Advantage plans, again, Part D is included at no extra cost, right? These are your Medicare Advantage plans, your HMOs. All the plans do vary depending on the formulary. So one plan may have your medications at a certain tier. Some plans may not have that medication. Mm-hmm. So yes, they are included.
Okay, and speaking of Part D, someone actually included their experience here. They're saying, I was placed in a drug plan from my broker who I'm very unhappy with. My medication costs have tripled and I'm stuck in the plan until open enrollment. How can I change to a new drug plan?
Yeah, so that's actually, well, sorry to hear that, but so you can either go, if you're on a Medicare Advantage plan, again, you have until March 31st to make a change. If you're in a supplemental plan, you would have to go out and get a standalone drug plan. Shop around for those standalone drug plans. Mm-hmm. Same thing on the Medicare Advantage plans. All the plans offer different formularies and tiers. So you have until March 31st to make that change.
Okay, and I think it's really important that we emphasize when folks can enroll and then when folks can make a change if they're not happy with their original selection. I know you covered here, but can you just recap that one more time for the people?
Yeah, absolutely. So your annual election period, that's from October 15th through December 7th. And during this time frame, that's where you can shop around, get plan comparisons, attend meetings, right? That way you have an idea what these plans look like, what their formulas look like, and see if those benefits are going to be happy and they're going to be a good fit for you. Right. And again, your open enrollments from January 1st through March 31st. So if for some reason you're not happy with that plan, you have until January 1st through March 31st to make one more change.
Now, is that a change in the plan, change of the doctor, any kind of change?
Both. You can change your health plan or you can change your doctor. Again, Chris, if you're on a Medicare Advantage plan, you can change medical groups year-round. Okay,
sounds good. Thank you. Another question. If I am already enrolled in basic Medicare with no Advantage plan, how can I enroll in a Medicare Advantage plan?
Yeah, so that's a great question, Chris. So if you want to enroll to a Medicare Advantage plan, again, you have until March 31st or you're getting off your employer plan or maybe your spouse is retiring. There's a lot of special enrollment periods, right? If you get diagnosed with a chronic condition throughout the year, it opens a special enrollment period. If you move counties, it opens a special enrollment period. If you're under your spouse insurance and your spouse decides to retire, it opens a special enrollment period for the both of you. And now you can start looking at Medicare Advantage plans or supplemental plans.
Okay, and that's along those lines, are there penalties for switching plans or leaving Medicare Advantage?
So there are no penalties, but you have to be very careful. If you, for some reason, stop paying your Part B premium, there will be penalties, right? But no, if you change Medicare Advantage plans, supplemental plans, there's no penalties. Yeah, none of those penalties will apply.
Okay, sounds good. Another question. I would like to keep my family doctor, but need to choose a plan. How can I ensure that my doctor is in network with that plan?
Yeah, so if you're happy with MemorialCare or GMP physicians and you want to be sure that one of the plans that your doctor accepts, I'll be more than happy to confirm. Same thing with specialists, right? Some people are more, they like their specialist more, so we can definitely verify what plan the doctor accepts, and we'll be more than happy to guide you into keeping your primary care doctor with you.
Okay, great. Switching gears, the last question. Is it true there is a senior food card for $900? There are ads on Facebook and the TV all the time. Are they real or are they a scam?
This is very scary, Chris, because I've heard nightmares, of people clicking on links or calling these numbers. And, it depends. Every state is different. Some states offer some benefits. Here in California, I haven't heard of any plans that offer that. So I'll be very cautious. It might be a scam. And that's why it's very important to deal with somebody that's local in your area, understands the benefits of plans, of medical groups, because we'll know if this is fraud or not, right?
Right.
And again, by you attending our Medicare free seminars, ask any questions like this or bring an ad or something like that, and we'll be able to tell you, no, you know what, that's a scam. Instead of you running the risk of, making a call or giving your personal information out. So be very careful. Yeah, okay. It sounds like a scam.
It does sound like a scam.
Yeah. If not, sign me up.
Right, exactly. Okay, I think that does it with questions. So thank you so much, Jose, for covering the content. For those of you who are interested in more information or learning about what Medicare options that we accept here at MemorialCare, you can contact Jose. His contact information is up on the screen there. And it doesn't matter whether it's open enrollment or outside of open enrollment, we are here for you all year round. We hope you've enjoyed this session and have a great day.